Kaiser Permanente, which became a Hall of Fame company in 2016, has repeatedly demonstrated its dedication to diversity and inclusion and the well being of all people. Recently, it has been outspoken about issues of maintaining mental health during the COVID-19 crisis and has made resources accessible to its members and the public. Effectively addressing bias and stigma in companies is crucial for all aspects of business, especially since we have felt the global impact of COVID-19, which has disproportionately impacted non-white communities. Here with me to discuss the impact and discuss the bias and stigma on how Kaiser Permanente is leading the fight against COVID-19 with technology is Dr. Ronald Copeland, Chief Diversity Officer at Kaiser Permanente. Dr. Copeland, thank you for being here with us this morning and kicking off our event.
Thank you, Carolyn. It's a pleasure to be here, and congratulations on your first virtual approach to the DiversityInc Top 50 announcements.
Thank you so much, Dr. Copeland. And I feel weird calling you Dr. Copeland, so I'm going to go back to what I always call you, which is Dr. C. um, and
That's
so
fine.
let's dig right in, okay? What is Kaiser Permanente doing in the fight against the COVID-19 pandemic, Dr. Copeland?
Well, first of all, let me say how heartbroken we all are that the entire country and entire globe, for that matter, is going through this horrific experience. The lethality of this disease, the disproportionate impact on vulnerable populations, its global impact, and the fact that we don't have a treatable approach to this at this point has just created some pretty devastating impacts on people all over the globe. So we honor those who are fighting on the front lines and extend our deepest sympathies to all those who have suffered loss during this horrific period. Kaiser Permanente, since we are an integrated healthcare system, we provide health coverage as well as provide care across the entire spectrum of wellness, acute care, chronic care. And in the case of epidemics and pandemics, we have a fair amount of experience based on our history with these as well. And so our approach has really three major areas of focus. One is what we're doing with our patients, what we're doing with the communities that we exist in, and most importantly, what we're also doing with our workforce. For our patients, we're providing cutting edge care and services to those in need. We've had to adjust our caseload and our hospital arrangements to accommodate the increased number of people needing respiratory support. We've been very active on the research aspect of doing some of the early research on vaccinations to try to create cutting edge solutions for the future. For our patients, we've also really accelerated our deployment of telehealth access so that distancing that we're trying to do to avoid contamination and spread, to account for the transportation challenges that some of our patients may have. We found that expanding our telehealth services, including video, texting, phone, and so forth, has been a godsend for our patients who've been able to stay in contact with their physicians, get their needs met. Our pharmacies are able to forward medicine to patients without having them come to our facilities. So we've made those adaptations. We've made major investments in our taking care of our workforce to make sure they're working in a safe environment with appropriate equipment, and that from a inclusive environment, we are constantly pushing out messaging around the importance of inclusion and equity, and we're making sure that stigma and bias as we encounter it is addressed on the spot.
And so, Dr. C, we've heard a lot of people talk about the disproportionate impact that COVID-19 is having on communities of color and on poor people. But unfortunately, when we think about like the hard facts around the representation of those groups, it's hard to find those numbers. And I know this is something that you and the team at Kaiser have been working on. And so, can you talk a little bit about what you're seeing on how COVID-19 has had an impact on the communities of color, and specifically what you all are doing to make sure that those vulnerable populations have support?
Yes, this is another example, I'm afraid, of historical legacy where when a major illness or disease impacts the community across the country, that there's this disproportionate impact on people of color, particularly Black people and our Latinx populations. What this pandemic has done is just shine a bright spotlight once again on the brokenness of our public health systems. And for our members that we provide care to, as well as for communities in general, we've seen this devastation and this disproportionate impact. What we've been doing for a long period of time is taking on the issues of disparities, understanding root causes, both the social needs, structural racism, the socioeconomic disconnections, and the impact that this has had on people in terms of their jobs, their exposure to risk, these segregated living conditions in urban areas that concentrate populations and therefore make it easier for spread to occur. All the things that we've seen and heard in the news, we have seen in many of the communities that we work and live in as Kaiser Permanente, whether it's in the Oakland Bay Area, in Los Angeles, in Atlanta, or in the DC area. We've had firsthand observations of this. One of the challenges, as you mentioned, is whether people have data to help them identify these disproportionalities, and then from an equity lens, making sure that the distribution of resources care is brought to them in a moment of need. We have, in our own patient population, documented what our trends look like, and certainly in some of our areas where we have high African American or Latinx populations, we have seen increased exposure to our patients. But more broadly into those communities, we are actively participating with lots of the safety net organizations, the CDC, multiple hospitals, to make sure that during this acute period, the needs that people have for medication, for housing and shelter is met in real time. We're making many investments in affordable housing and creating support with community leaders to put people who are homeless into hotel spaces to protect them during this period, and doing all we can to collaborate with others to understand and address the drivers of these disparities. Now, we know this has been longstanding and that this is not something that can be corrected overnight, but using this opportunity not only to provide care and support in a collaborative way, but to use our voice for advocacy as relates to policy change related to how care is provided, who's covered, and the services that need to be addressed. But it is another demonstration of the fragility of our existing public health services and how long-term investments are going to need to be made to address this. You know, W.E.B. Du Bois used to talk about the peculiar indifference that he experienced in the late 1800s around how, from a humanitarian standpoint, we all could witness these disparities and yet feel less compelled to do something about it. And so once again, that challenge before us, and if we are wise, if we are inspired, if we are truly for inclusion and equity, we have yet another opportunity to be inclusive at the community level.
And so can we talk a little bit about how our workplaces have been affected during this time of uncertainty? And specifically, can you share some best practices for supporting diversity and inclusion during these challenging times? And I've been sending a lot of folks your way because of the research that you all have been putting out, that we have been pushing out through our newsletter. But a lot of the people that are on today's broadcast may not have seen that. And so if you could just cover some of the resources that Kaiser is putting out there to help workplaces deal with these challenges with their employees, I think that would be really helpful to our audience.
Okay, thank you. Well, I think first and foremost, we know when this type of crisis is underway, people are going to feel high anxiety. They're going to be addressing fear. and tremendous uncertainty about their future, concerns about their own personal health, about the health of their families, and for the people in our workplace that are on the front lines who are having to be intermediaries between people who are suffering and in some cases losing their life and their families who in many cases are not allowed to be with them during those precious moments. These are obviously very high anxiety and stressful periods for all people involved. So for our workforce, we have always and continue to emphasize from a resilience standpoint, the importance of people focusing on mindfulness and wellness to make sure that they have a way of recovering, that we support each other with a focus on mental health. We are pushing out on our website and out to many of our employees all the important messages and resources they need for providing self-care and care to their loved ones. We've had to adapt the workplace and where people work and how they work so that the need for flexibility is there related to childcare because of schools being closed and people working remotely trying to address their work, their family, as well as become teachers on the spot. So these things put people under tremendous stress. And we've created some apps for folks to download so that they can, in a real moment, needing some support and resources and effective practices, can have immediate access to it. As it relates to the stigma and the fear that also shows up during these critical times, we are also making sure that we're sending out very significant messages and coaching our people about the implications for stigma and xenophobia as they come into this situation, either from patients or from families or from our workforce, to make people understand that this is a time for compassion and ethical approaches to the services we deliver and to the importance of people really feeling a sense of belonging and community. So this is as much about taking care of each other and supporting each other as we also take care of the people that we're committed to serve. And it's important for leadership to demonstrate to people that they are valuable, that they belong, and that we care. And so we listen to our people. So it sounds old-fashioned, but just active listening and then finding creative solutions to support people during this crisis period is really critical. And my observation has been that in healthcare, we have people who have dedicated their lives to taking care and providing services to others. And what they want more than anything else is to have the ability to make a meaningful difference in people's lives. So they want to be supported and enabled with technology, with equipment, with opportunity, and with appropriate staffing to provide that service. And they want to make sure that they are working in a safe environment, so their concerns about being exposed themselves or tracking that to their families is minimized and mitigated at the highest level. So those are some of the things that we're doing to make sure that wellness and inclusion and a sense of belonging are really front and center during this period. And for our leaders, it's important for all of us to demonstrate and model the inclusive leadership attributes that signal to people that they are valued, that they are important, that their voices are critical to finding creative solutions. And I've just been amazed at the response of our people across the board, but certainly in the front lines, that given the challenges they're having and because they feel they're working in a safe and trusted environment, the level of innovation and breakthrough thinking that has occurred has just been breathtaking to observe. And it just reiterates the importance that we talk about all the time, that the value of having a highly diverse team working in an inclusive environment is that it takes advantage of this tremendous brain trust of everybody using their unique perspectives to problem solve and come up with the best idea to go forward and find meaningful solutions for everybody we're taking care of.
And so, Dr. C, you talked about some of the resources that were provided to team members. I know that you also included information to employees about recognizing and mitigating bias, and stressed the importance of employees speaking up when others are spreading misinformation or engaging in discriminatory behavior. Can you share any feedback from your employees about how helpful those tools were and how they were leveraging them both with their coworkers and then within the hospitals, even in some cases with their patients?
Yes, we've been very intentional in spreading that word. And I think it starts with communication and speaking to the issue as an expectation to create psychological safety. Because whether it's in our normal work days or certainly under these conditions, people have to feel that their voices can and will be heard. And we're a large decentralized organization with over 200,000 employees, 39 hospitals, and across multiple states. So everyone has got to identify themselves as a leader. And in the moment that they witness or observe any evidence of stigma, xenophobia, or bias in action, we have to rely on each other to help counter that and to give people encouragement and further instruction about how to address an issue in a more compassionate way. And we should also keep in mind that working under this kind of stress, this is when bias and stigma is most active because we're working in a state of anxiety and fear, and our brain is going into protection mode. So what our employees have said to us many times is how grateful they are that all their leaders, formal and informal, are speaking up, modeling the importance of calling these things out, serving as allies on the moment, and out into the communities and their volunteer efforts and in their engagement, feeling very compelled to speak their truth and to have their truth heard. And there's that benefit, but it's enabled by creating a psychologically safe environment where people don't fear retaliation. They know that they'll be listened to. And we create this macro ability to reinforce and support these efforts at a cultural level. And the good news for us is that because we've been on this journey for a while, as part of our normal commitment to equity and inclusion and building an inclusive culture, that investment over time is now serving us very well under the current circumstances. But it's one of those things where you can never take your eye off the ball. You have to continually invest. You have to continually practice and enable. But that's the way you have to scale it, because that's the biggest challenge is how do you scale this in large decentralized organizations? And then there's the power of stories. Our employees and our patients tell us very compelling stories about the difference someone has made by speaking up, by supporting them, by going that extra mile. And so we bring those stories front and center to our entire workforce so they can see their work and the work of their colleagues in stark form and in the most meaningful, compassionate ways. And the inspiration that provides is another important aspect of well-being and mindfulness, to see and celebrate us doing our best at a time of need.
No, absolutely. And I think that is a great segue into my final question before we take a few questions submitted through the chat. And that is really based on the theme of today's event, which is unapologetic leadership. What can leaders do to create an inclusive work environment as we navigate the current times and look ahead, right? We talk a lot about what recovery looks like. So what are some of the lessons around unapologetic leadership that folks can learn that we can take into the recovery so that our people do have a greater sense of psychological safety at work and they do feel they belong?
Yeah, I think one of the critical principles for me as relates to unapologetic leadership is that you're leading from a sense of principle and value of human life and committed to that. And so I think as our former CEO once said, you don't have to ask for permission to serve and improve the health of the people we've taken an oath to serve. That we don't have to apologize for that. We don't have to ask for permission. And that commitment has to be true. I think we leaders have to be conscious of mitigating bias, understanding how implicit bias works, and the type of bias that shows up under these circumstances. And speak to that, not only as a leader, but also providing instruction and tools for people to understand and have the capability to address and mitigate bias in real time. The most important thing, I think, coming out of this whole experience for us as we look into the future is what are some of the key lessons learned about disparities, about the role and impact of bias, and structural racism and socioeconomic support. And as we go forward, we have to see ourselves not only as providers of healthcare services, but as leaders, as advocates for social justice and for policy changes that will disrupt the next iteration of healthcare. So when people talk about returning back to quote unquote the normal, I think an unapologetic leadership perspective is the normal was not serving us in an optimal way to begin with, and too many people were left out and left vulnerable. So if we're going to create a new normal, let's harvest the hard lessons learned, the inappropriate and unnecessary suffering that we are witnessing, and just determine once and for all, can we muster the moral and political will to bring a 21st century public health system to this country and to provide coverage for every patient.
All right, thank you for those insights, Dr. C. And so I'd like to spend a few minutes going through some of the questions that have been submitted. And so the first one is, have your goals or strategies in your daily work changed since the pandemic? If they are different, how did they change and why?
Well, since we're in healthcare, our goals of improving health care and health outcomes for our members and patients and doing it in a way that's increasingly affordable and impactful and that drives high quality, that's our core mission that we come to work to do every day. So that never changes. That's the reason our organization exists. But what has changed is our ability to be agile, to be innovative in real time, and to understand that while we're doing the short-term impact for acute illness, we also have to be mindful of what our long-term trajectory is as a change agent. So the goals have not changed, but their goals have short-term impact, and then there's the long-term game, and both have to be simultaneously addressed. But all of our energy, or the disproportionate amount of our energy, has been to make sure that our number one mission, which is to provide healthcare and services, is met. And then secondly, that we are creating real-time adjustments and adaptations in our work environment to support the people providing that care.
And I guess this person wants to make sure that they also understand, outside of dealing with the impact of COVID-19, are there any major successes that Kaiser has had so far in 2020 that you think are important to share, especially as we make sure that our diversity and inclusion strategies don't take a back seat, and that we don't backslide on a lot of the work that we have done over the past 3 or 4 years?
Well, yeah, I think that's a great question. I would say the success has been based on the fact that equity and inclusion is part of our strategic framework from the beginning. So it's not something that we are just in this moment paying attention to. It has been and will continue to be a long-term strategic focus. We have integrated the concept of equitable care outcomes into our quality improvement agenda. So we don't really consider something high quality of care unless we have also measured and evaluated the metrics of inclusion, of culturally responsive care, and outcomes that eliminate disparities based on our understanding of the drivers of those. So those success stories, I think, are based on creating access for all the people we are responsible for providing care to, but also having the agility and the adaptability to customize solutions that work for everyone. So people who may have public transportation challenges during this period, we have made sure that we have reached out to them to identify their social needs and then to address them in a customized way based on where they live and what their needs are, to make it as easy as possible for people to still have access and affordable care. We during this period of time, we eliminated copays for people based on getting care related to COVID-19 as another example, to make sure that we understand where people live and their realities, and we are adjusting our approach to care so it's not one size fits all. The outcomes we want for everyone are the same, which is the best care. But the way we approach it and the adaptations we make is based on a more detailed understanding of what they need and what their living experiences are, because we understand that has more impact on their health than mostly anything else. And so what I bring those examples up because that's evidence of equity and an approach to inclusion in action, not just in words and then framework, but actually integrate into the way we think about and measure and define care.
And so, as we get ready to receive the panel that will discuss formal sponsorship, a scientific and successful approach. The last question really does come from me, Dr. Copeland, and then I'd love to hear any final thoughts that you have. We talk a lot about, the negative things that have resulted from COVID-19. But based on the communications that I'm seeing, I think that there are a lot of positive outcomes so far in understanding, how well we work together, having a reset on how people value talent. Are there any positive outcomes that you are seeing that you'd like to share from that you all are seeing at Kaiser Permanente?
Well, I think I would, and I think I mentioned them earlier, is that what has been most impressive and most gratifying is that as the stakes have increased across the board, to see all our people rise up and put patients first, put serving others first. And we know that's part of the people that are attracted to healthcare and people come to work with that kind of daily mission. But when we get into routines, sometimes we lose our focus. And this has made it crystal clear and brought back into focus the real purpose and value of why healthcare organizations exist, and certainly why ours exist. And people have had the chance to serve our mission, our core mission, and the people we serve at the highest level. And to see people rise up with courage, conviction, and to be fearless and unapologetic, if you will, in taking on the challenges and the issues, even many times at some risk to themselves and to their own families, but rising above to that level of courage and service. And so that's been more than gratifying. It's been inspirational. It's certainly why I became a physician. And to see all our healthcare professionals working as a team has just reinforced and made palpable and highly visible what we talk about all the time, is that highly diverse teams of all dimensions operating and working in an inclusive environment and anchored by a common purpose and mission is a really tough thing to beat. And if we could duplicate that, scale that, and bring that focus and attention and determination to our work every day across this country, then many of the gaps and disparities we've identified, once again, we have a really great shot at transforming healthcare for the benefit of everybody in the country. And so that's the opportunity. That's the core lesson that we're taking away. And that's the inspiration that this fight has provided for all those concerned.
Well, Dr. Copeland, thank you so much for your time today and the information that you provided to us. It is extremely valuable, and it is always a pleasure for me personally to be able to speak with you. So thank you so much for your time today again. And for the folks that are on the line, we are going to receive next Lisa Hunley, DiversityInc's Head of Client Fulfillment and Strategic Partnerships. And she will be hosting a panel discussion with leaders from Hilton, AT&T, and ADP. Thank you.